Ms. Sandalow.
Good morning, Chairman Catania, members of the committee. My name is Judith Sandalow. I'm the Executive Director of the Children's Law Center and a resident of the district. I'm testifying today on behalf of CLC, the largest nonprofit legal services organization in the district, and the only such organization devoted to a full spectrum of children's legal services. Every year, we represent 1,200 low-income children and families. Almost every single one of those 1,200 children is a Medicaid recipient. I'm grateful for this opportunity to testify regarding the performance of the Department of Health Care Finance over the past year. We were very pleased when the Council created the department and elevated the importance of solving the Medicaid problems that have plagued the district. 61% of D.C. children are enrolled in Medicaid, so a properly functioning Medicaid system is vital. Medicaid-funded services promote more than our children's physical and mental health. They are truly the backbone of our child welfare, early intervention, and special education systems, providing the services that reduce children's stay in foster care and aid their academic achievement. During the past 2 years, we have been encouraged by the real progress we have seen the department make. The leadership is extremely strong, and many staff positions have been filled with quite well-qualified individuals. The department has begun to promulgate regulations that have been needed for many years and has been aggressively filing important state plan amendments. Despite the notable progress the department has made, there is still much work to be done, and we are concerned that some of the initiatives have stalled. We urge the department, the mayor, and the council to treat the situation facing children using Medicaid as the crisis that it is, and to making solving the problems a high priority. My written testimony addresses 3 priorities for children. First, fixing the fragmented mental health system. Second, developing a system for providing oversight and accountability to MCOs. And third, moving forward with the delayed administrative service organization. Because of time limits, I will only address the first issue today. Our Medicaid-funded mental health system, as you know so well, is too complex for both families and providers. There are 4 MCOs, there's fee-for-service Medicaid, a separate MHRS system. MCOs are responsible for providing office-based mental health services such as counseling or family therapy to children. However, when children are diagnosed with severe mental illness and need more intensive in-home therapies, the responsibility for providing services shifts to the Department of Mental Health, and the payment shifts directly to Medicaid. DMH uses a network of core service agencies, just to complicate things, to provide their mental health services. Providers must credential separately with each MCO and subcontract separately with each CSA, which is a time-consuming process and is often mentioned by providers as the reason they will not accept DC Medicaid. To complicate matters, children who are enrolled in an MCO switch to fee-for-service Medicaid if they enter the foster care system. In order for that child to maintain continuity of services, their mental health provider must also be properly credentialed as an MHRS provider. This complicated setup has led many providers to refuse to contract with Medicaid at all. Lawyers in our office have come across many providers who accept Maryland and Virginia Medicaid but refuse to accept DC Medicaid because it is too burdensome. This leads to a shortage of providers, resulting in many children failing to get important medical and mental health services. Last year, the district agencies that are collectively responsible for the children's mental health system, DMH, this department, and CFSA, met to discuss options to address this critical problem. One option that was considered was a carve-out from the MCOs and having either DMH or another entity such as a specialized managed care behavioral health organization run the mental health services for all beneficiaries. The department contracted with GW to assess children's behavioral health services.
Ms. Sandalow, if you could just summarize, please.
I could. My biggest point is the results are coming out. We hear that there's no solution being offered by GW, and our biggest point is we just can't wait another year. And we believe it's the lack of any one agency being asked to lead on this which has caused the problem, and we would ask the council to be involved. Thank you.
Ms. Pickett.